We had a very interesting session of an update on hepatocellular carcinoma. We had 3 talks. The first one, which I gave, dealt with the risk factors and epidemiology of hepatocellular cancer. The second one dealt with advances in chemotherapy of hepatocellular carcinoma. And the third one gave us an update on the role of ablation in hepatocellular cancer. Hepatocellular carcinoma affects more than 700,000 people every year worldwide, and particularly here in the United States, it has become the fastest cause of cancer-related deaths in the United States, and half of the cases, as we summarized, are related to hepatitis C. Virtually all the cases have an underlying condition of cirrhosis, and that has led to the discussion about the role of surveillance for hepatocellular carcinoma among patients at risk, namely those with cirrhosis and certain segments of patients with hepatitis B. We reviewed the recent AASLD guidelines for surveillance and the evidence that supports these guidelines. The update on the chemotherapy dealt mainly with the advent of sorafenib, reviewed the clinical trials that showed efficacy of sorafenib in prolonging life, and a discussion of newer agents that are currently being tested. In the ablation talk, there was a very important message, which was the progression of management of unresectable HCC tumor from a surgical approach predominantly 10 years ago to more of a local ablation modality. The evidence favoring radiofrequency ablation over the traditional ethanol injection was reviewed from randomized trials. Comparisons showed between ablation and surgical resection, and the conclusion and recommendation were given for the appropriate scenarios in which these 2 modalities could be used in the treatment for hepatocellular carcinoma. Overall, an interesting and a very informative session. Thank you.